It is common to hear that modern and new is much more better in terms about just about anything. For the most part, this is true. However, in terms of medicine, it may not be the case. Herbal or traditional medicine, also known as indigenous or folk medicine, are medical knowledge systems that develop over generations within various societies before medicine. Today I would like to inform you about the benefits of herbal medicine when treating insomnia, migraines, asthma, and depression. In 1500 BC, a vast understanding of medicines with cultures in China, Africa, and India began codifying their knowledge and documenting for future use. In 1820, 70% of drugs were plant-based. In 1960s, 5.3% of medicine was plant origin. Indigenous tribes are a big resource for modern medicine in terms of old traditions. For insomnia-related cases, patients can buy over-the-counter hypnotic drugs called, I have trouble pronouncing this, diphenhydramine, which induces drowsiness, develops tolerance, and sometimes the drug can no longer affect the user. This, using prescription over-the-counter medicines, can decrease stage 4 or even REM of REM sleep, affecting the quality of sleep. Such risks of using drugs are physical and psychological dependent. An alternative to that, instead of using drugs, is tea. Tea contains a unique anxiety-reducing amino acid called L-thiamine. This can also be effective in promoting concentration, strengthening the immune system, lowering the blood pressure, and increasing the formation of inhibitory neurotransmitters. The second one is migraines. For migraines, which is a severe recurring headache, usually affecting only one side of the head, that is characterized by sharp throbbing pain and is often accompanied by nausea. Such drug that is sometimes used some medication that is used to go along with migraines is topomax, which lowers the numbers of migraines, except that some side effects of this medication includes lost weight, loss of appetite, and can cause or increase levels of depression. An alternative for migraines is tea as well, which is green tea, which soothes the body and keeps oneself properly fed. It's slow, but it sure is known to be effective. Another one is asthma. Asthma, which some of you may know, is an inflammatory disorder of the airways which causes attacks of wheezing, shortness of breath, chest tightness, and coughing. Modern medicine like Pulmicort and steroids for enhancing the body are most helpful when treating this type of disorder, except that some side effects of these medications, however, can also include nausea, loss of appetite, sometimes vomiting, and skin rash. An alternative for asthma can be traditionally treated with sour food sources. These sour food sources have receptors for bitter taste that are found in smooth muscles of the lungs and airways that other than just the tongue. When bitter taste hits the receptors of the smooth muscle, it can cause the airways to relax and expand more widely. Then the last one, depression. According to which is a chemical imbalance theory, which low levels of the brain chemical serotonin is what leads to depression, because serotonin is what helps regulate the person's mood. A big risk of antidepressants is that researchers know very little about how antidepressants work. The reason for this is because there is no test that can measure the amount of serotonin in the living brain. The side effects of antidepressants include nausea, sometimes insomnia, anxiety, restlessness, and dizziness. In some cases, antidepressants treatment can cause an increase in depression levels, and increase of suicide. An alternative to the drugs that are used for depression is an herb called St. John's wort, which it takes 4 to 6 weeks to notice the full effect. Side effects may include dizziness, dry mouth, indigestion, light sensitivity, and sometimes fatigue. So those are the 4 major I guess disorders that some people may have, and right away, instead of going to the drugstore and taking medication, you should really try thinking about maybe taking tea. There are other alternatives to taking care of these effects.
So Brandon, what did you think?
I really enjoyed the opening with giving a lot of historical background on herbal medications. I thought that was really well done. It was obviously very well researched. I think the only really big criticism I have is that you spend a lot of time reading from the cards. You would look up and you would try to make eye contact, but for the most part you spend a lot of time reading the cards. But that's the real main criticism I have. Outside of that, it was very well informed, very well researched. So, yeah, that's pretty much what I got.
All right, well, let's start with the presentation things first, since that's kind of where you had your reservations. At this point in the semester, we really want you to be doing a little bit better job, and you're very dependent on reading. You've got all of the little pieces of paper in your hand at one time, and it just looks awkward. Instead of engaging the audience, you're still doing some reading to the audience. I did think that you tried, whenever you went from your discussion about what the problems were with the modern medications to what the alternative medications were, you tended to try and look up at the audience and then engage us. But because we've tuned out, because we're watching you read in the first part, I think people are going to miss that second part where there actually is some attempt to engage the audience. So I think that that's a little bit of a problem. Because the pieces of paper that you have are pieces of paper and not cards, you have to hold both of them, you have to hold them, I should say, with both hands most of the time, which means it really limits your body involvement in the presentation, and that's a little bit problematic. On content issues, I'm with Brandon. I like the opening. I like the kind of way of visualizing this idea and setting up the topic. But after that, it's a little bit problematic. You state as your thesis statement that your goal is to inform us about this. This is supposed to be a persuasive presentation, and so you need to convince us. You need to show us proof that these things are true. You've got general criticisms of medications on these 4 different areas, and I didn't hear a source citation that talked about who says all of these harms occur with these medications. Is this in the official information sheet that comes with the medications that the pharmacies provide you? Is this a doctor's advice on taking those medications? I mean, some of those side effects are pretty negative. On the other hand, some of them sounded pretty good. It sounds like I should be taking a bunch of those medications to help me lose weight, because that seemed to be the main problem with a lot of them. It decreases your appetite and makes you nauseous. So if I could just live with being nauseous all the time. Well, I live in California. That makes me nauseous most of the time. I think you need better citations of the information. It really feels like you've got this idea here, and it's organized clearly. It's not hard to follow. You've got the 4 examples that you're talking about. But on each of these points, there's not much information being developed. We've got conclusionary statements on these things. I'll give you a quick example, because I remember this speech. This was 5 or 6 years ago, I had a whole speech, 10 minutes, devoted to St. John's wort as a solution to a lot of medical issues, in particular depression. There was all kinds of research in it. There were good examples. There were criticisms of some of the other things that people used. It was really well developed, and it was just about that particular subject. Yours is kind of a toss-off here. It's 35, 40 seconds on that particular subject, no source citations, no stories, no anecdotes, nothing emotionally involving. It's just, kind of an outline of an idea, and it needs to be more than that. All right, thank you.